Hello everyone, myself Dr. Namrata Vithalani. I am practicing as a physician and intensivist in Surat. Today in this video we will discuss regarding the CHA2DS2 VASc score, that is the risk assessment tool for the risk of stroke in patients with the atrial fibrillation. As we all know, there are basically three goals in the treatment of AF, that is the rate control, rhythm control and stroke prevention in atrial fibrillation. Out of this, we will discuss regarding the stroke prevention in atrial fibrillation, especially non-valvular atrial fibrillation. That's CHA2DS2 VASc score that has been defined for patients with the non-valvular AF, that excludes the patients such as with the rheumatic heart disease, mitral stenosis, and that with the prosthetic heart valves. So what is CHA2DS2 VASc score? In that we give points to the specific risk factor, and we define what is the risk of stroke development in that patient, and accordingly so that we can plan the anticoagulation therapy for the patient. So if we look at the CHA2DS2 VASc score, so C, that stands for the congestive heart failure. So any patient with the history of heart failure or LV dysfunction. Then H is for hypertension, that is BP recorded more than 140/90 on two separate occasions, or if patient's blood pressure is controlled with the antihypertensive therapy. A stands for age more than 75, that has got the 2 points. Congestive cardiac failure and hypertension, it has got 1 point. Age more than 75, it has got 2 points. Next is the diabetes. So that defines fasting blood sugar of more than 125 on two occasions, or if patient's blood sugar levels are controlled with the oral hypoglycemic agents or with the insulin therapy. Next is the in the CHA2DS2 VASc score is the S. S is the any previous history of stroke, TIA or thromboembolism, that carries the 2 points. Next is the V, stands for the vascular disease, any history of the myocardial infarction or peripheral vascular disease or aortic plaque. In CHA2DS2 VASc, A stands for the age, that is age around 65 to 74 years of the age, that carries the 1 point. If age is more than 70 greater or equal 75, that is 2 points. Age 65 to 74, that carries the 1 point. And last is the S, it stands for the sex, female sex, it carries the 1 point. So there are total 9 points, out of which if we get 1 or more point in the man or 2 or more point in the female, it is an indication to start anticoagulation in non-valvular atrial fibrillation patients for the stroke prevention. So this anticoagulation therapy, it should be started based on the thromboembolic and considering the thromboembolic risk and the patient's profile for the bleeding risk. So if we get 0 either in the male or female, it is a low risk. If it is 1 in the male, it is an indication for anticoagulation. Anticoagulation should be considered, and 2 or more in the either male or female, anticoagulation should be started in patients with the AF for the stroke prevention. Thank you.